I'm Virginia Prescott from the What You Need to Know Coronavirus web series from GPB. Today is Tuesday, March the 17th. We're recording this at about noon Eastern Time. Currently, 4,661 confirmed cases of COVID-19 in the U.S., 121 in Georgia. Worldwide, however, more than 80,000 people have recovered, so that's something to keep abreast of. Joining us via Skype is Dr. Colleen Kraft. She's Associate Professor in the Division of Infectious Diseases at Emory's Clinical Virology Research Laboratory. She's also on Governor Brian Kemp's Coronavirus Task Force. Thank you so much for being with us.
Very happy to be here.
So the roads are free from traffic today. It looks like some people are paying attention. I think a lot of people do know the difference here, but could you help distinguish for us the distinction between social distancing, quarantine, and isolation?
Right. So isolation is when you are put into a place where you are separated from others. And so you are sick, you have the disease, and you're isolating yourself from others. Social distancing is just sort of when we're in public or when you're around other people, just sort of keeping your distance. I think actually as Americans, we're pretty good at this if you think about other countries and other practices. And then quarantine is really when people who are not unwell are kept away from others. And so that's sort of how we think about is the person that's in by themselves, what their sickness level is, right? So if you're sick, it's called isolation. If you're not sick, it's called quarantine. And if you, again, are in public, it's social distancing.
Dr. Kraft, the concern, of course, is that healthcare workers are frontline, may get sick. How do you keep them safe, especially at this critical time?
So we have been spending 2 months really talking about protocols. Things have changed as we've gotten more patients in that are suspected. And so we continue to really hammer out the things that we always should be doing during respiratory season, which is wearing the appropriate personal protective equipment when we see a patient that's coughing or has a fever, cleaning surfaces, limiting people that are in and out and in the healthcare system that may also be carriers of the virus. And so in a sense, I feel like a side effect of this outbreak is real big attention to these protocols we should be doing anyways, but we get a little bit lax, right? Because we don't always see the ramifications of our actions.
So as tests are more available, do you expect to see more healthcare workers testing positive for the virus?
So we were really surprised that we did not have that many positives at all among patients or healthcare workers initially. And so I think it's really hard to predict where we're going to be at the end of the week, for instance. So we think that it's increasing, but we're also not sure if we're better at picking the people that need to be tested. I think once we have very wide scale testing, then we'll really understand the spectrum of this disease. But I think at this point, it's a little bit early. We are still seeing people that are very sick from this disease, so it's not something to take lightly, but most of the people we are seeing are very mildly ill, if ill at all.
So that is a question I have. Politico published a state-by-state breakdown of the ratio of testing to confirmed cases. Most states getting a mix of positive and negative, but Georgia's numbers from Monday indicated that all 121 tests came back positive, the only state with a caseload of this magnitude and 100% positive ratio. What does that indicate for you?
Yeah, so for me, I need to still drill down in that Politico article. I'm not really sure where those numbers are coming from. I can tell you that as the individual that's coordinating our testing here at Emory Healthcare, that our numbers are definitely a mix of a much lower number of positivity. And so I don't know if it's just our reporting. There's always these issues with statistical reporting. Did they report the correct denominator versus did they report all of our individuals that were tested or just those that were tested positive?
Got it. So how about for those who are trying to stay healthy in self-isolation or in quarantine or social distancing? What to do, especially if you're staying home, taking care of others, maybe children or parents. When you do leave the house, you go to work, maybe if you still have to, or go to the grocery store. What do you do when you come home? And what should people know about that?
Yeah, so I think, again, a side effect of this outbreak is going to be that we are doing the types of hygienes that we should be doing during respiratory season. We really should be wiping down our surfaces at home. If somebody's sick, then making sure that that person is isolated in the home, washing everything after that person's been ill that they've been touching. And in general, when we're in public, I think wiping down the grocery cart. That's something that has started to appear more widely, and people are focused a lot more on the surfaces that they're touching. But if you don't have a way to wipe down something that you think may be dirty or other people have touched, also just don't touch your face until you washed your hands. So you just are, I think, an awareness of our surroundings, what's dirty and clean, what we have control of, and then cleaning them after we've touched them and cleaning our hands after we've touched them is really important.
I know you've been in demand a lot this week. What are some of the questions that you're getting most that you think people would like to know the answer to?
So I think that's a great question. I think one of the things that I've been asked a lot is are we overreacting as a society? And I think one of the things that reassures me is those curves that the CDC has been showing that are very flattened when you have some sort of social intervention, such as school closing, teleworking, all of those items. So it allows individuals to not be together. And then what ends up happening is we hope to sort of eliminate it from our population, sooner, because we really haven't cohorted everybody together in our typical behaviors.
Dr. Kraft, thanks so much for your time.
Really appreciate it.
And you can stay up to date with all of the COVID-19 news generating in the state and nationally and internationally. There are also resources at gpb.org/virus.